We trust our schools to not only teach our kids, but also keep them safe. Yet a WCNC Charlotte investigation found an area school district has refused to take on a potentially life-saving responsibility. Despite terrified parents begging for change, WCNC Charlotte's Nate Morabito discovered Union County Public Schools is denying kids with a rare disorder around-the-clock access to a shot that, if needed, would save their lives.
Dominic Damato never wants to revisit the day his son Harrison,
he was 8 months old, literally gray and lifeless,
nearly died while battling the flu. But when you're raising a child with congenital adrenal hyperplasia, all it takes is an infection or a broken bone to send parents right back to that moment.
Sorry.
CAH is a rare genetic disorder that affects the adrenal glands. It requires maintenance medicine multiple times a day. And if something triggers a life-threatening adrenal crisis, demands either a stress dose taken by mouth,
He couldn't stomach the medication, he kept vomiting it.
or an emergency steroid shot in the thigh muscle.
So this is an emergency kit.
That shot,
The medication itself is this white powder.
which his parents always carry with them,
And then you flip it over and draw the medication with the syringe.
saved Harrison's life then,
Snapped right out of it.
and would do the same if the 6-year-old ever goes into crisis again.
Yeah.
But depending on the day, there's no guarantee he'd get it immediately at school when needed.
That's exactly what we're worried about.
As it stands, Union County Public Schools only allows school nurses to give out this kind of shot.
She's only there 2 days a week.
A problem most school days at Harrison's elementary school.
It's just scary.
And a concern 1 day a week at a different Union County elementary school that Danielle Piazza's 7-year-old son attends.
He could die.
Oliver's mom says in the boy's short life so far, he's already gone into crisis twice outside of school and needed injections both times.
Both incidents were just so scary.
Piazza says school staff are open to getting trained,
They are absolutely willing to do it, and the district is not allowing them.
but Union County Public Schools has told both families no one other than nurses can give the injection. Citing state law, the district's attorney told the parents the shot cannot be delegated to unlicensed staff in the school environment. The North Carolina Department of Health and Human Services says not only is that not true, no one can tell a registered nurse whether they should or should not delegate their duties. Instead, that decision falls squarely on the school nurse's shoulders and is based on the individual student and application of the North Carolina Board of Nursing decision tree.
Honestly, I think it's fear. Fear from the actual syringe.
Hoping it would help their cause, Harrison's family secured a doctor's note urging the district to change its stance, saying this is similar to using an EpiPen for a peanut allergy or glucagon for a child with diabetes, and noting this drug cannot be overdosed, making the risk almost negligible.
It rips my heart apart, knowing that my son could be in severe danger.
Both families have even said they'd sign liability waivers. He has the same thing.
100%.
The Damato family is actually twice as likely to see history repeat itself. Harrison's little brother has the same rare disorder.
The 3-year-old
Yeah.
is going to face the same issue when he gets to school.
Yes, he will.
Which is why their parents are desperate for Union County to make a change now.
Yeah, it would be a great relief.
Despite the state's stance and our questions, a school district spokesperson told us school health leadership decided against allowing other employees to give this shot due to what Union County Public Schools calls a detailed and intricate injection process, adding if there's a health crisis emergency, school administrators and nurses are trained to respond safely and appropriately. These families don't believe the existing response, which is call 911 and wait for EMS to arrive, is enough to save a child's life. Nate Morabito, WCNC Charlotte.